Good afternoon, everybody. Thank you for joining our Well-being Webisode. I'm going to give it one more minute before we get started as people are still joining us, but also want to not hold us up so we can get to all of our great conversation today. All right, we're going to get started. Hello again, and welcome to our Well-being Webisode, Stay Hydrated, Stay Healthy. I am Kelley, a health service specialist at Geisinger. Just some housekeeping that I want to note. There is a Q&A for today's session, so please enter your questions, your comments. I will keep an eye on them. If we don't have, we'll save them for the end, or I'll, sprinkle them throughout our conversation. So thank you again for joining us. Today I have Rose with me. Rose is a clinical dietitian at Geisinger within the Nutrition and Weight Management Department. She has a Bachelor's of Science degree in dietetics from Marywood and has been with Geisinger for 30 years. Today we're going to be discussing the very timely topic of recommendations for proper hydration. Review the benefits of adequate hydration, identify healthy drink choices, and explore strategies to stay hydrated. I'd just like to note here that this information is being provided to increase your awareness. It is not intended to be medical advice. If you have any specific medical conditions, questions, we encourage you to see your physician. Welcome, Rose, and thank you for joining us today.
Thank you so much for having me today.
So I don't think we could have planned this any better with the weather. Got lucky, but I don't think it comes as a shock to any of us on the call today that staying hydrated is important to our overall health. But why? Rose, what are the benefits of proper hydration to our health?
So hydration is very important to us. Surprisingly, our body is made up about 60% water. So every cell in our body needs water or hydration to function. And one of the benefits of hydration is this is the way that our body can deliver the nutrients to every cell in our body. It also helps to regulate our body temperature. It also lubricates cushions and joints, and it helps to rid the body of waste through urine and sweat. So yes, hydration is very important.
Wow, 60% of our body, that's more than half. So it sounds like proper hydration is essential for so many of the important functions that our body does. But what if we don't drink enough? Can you talk a little bit about the impact of not being well hydrated and what we should know about dehydration?
Yes, especially, you're right, this is a timely seminar because of the heat that we're having. So dehydration is not a good thing. Dehydration basically means that more water is moving out of our cells than is coming into the cells. And when the water is moving out, the electrolytes usually are moving out along with it. Dehydration also usually occurs if we're not able to keep up with our fluid intake for whatever reason. There's a lot of side effects of dehydration. For example, it can increase our risk for urinary tract infections, kidney stones. The elderly are usually at a higher risk for dehydration because as we all age, we actually have a decline in our thirst and we're not able to regulate our fluid intake as well. Signs of dehydration to look for: most commonly, look at your urine color. That's probably one of the main things. Typically, we often say our urine should be light to sunny yellow. So if you ever notice if your urine is starting to get more dark yellow, orange, amber, that certainly is your body's way of saying, hey, I need more fluid. But also if you notice if you're excessively thirsty, you have a dry mouth, if you notice you're not producing as much urine or you're sweating less than usual, your skin is very dry and hot, and then unfortunately dizziness, headache could even result in fainting. So it's definitely something we're trying to prevent.
Yeah. So we reviewed the benefits of staying hydrated and the dangers of dehydration. But I think an important question is, how much do we need to be drinking every day? I think we've heard out there the standard response usually is 8 cups per day. So my question is that accurate for everyone? If it's not, how much do we actually need?
So 8 cups a day is usually a pretty reasonable place to start. The National Academies of Medicine actually recommend 11 cups of fluid per day for women and 16 cups of fluid for men daily. I know that sounds like a lot, but when we think about fluid, it's just not water, although water definitely plays a role in that. We have to remember fluid is any type of fluid. So this could include soups, it could include broth, water, milk, popsicles, electrolyte drinks. Even fruits and vegetables have a high water content. Fluid needs do vary per person. It certainly does depend on our age, our activity level, even where we live. If we're living in a climate where it's very hot and humid, if we're pregnant or breastfeeding, those can also increase our needs. But again, in general, 8 cups a day is usually a reasonable place to start.
Okay, yeah, that was helpful to hear the other numbers because I think we do typically hear so much of, 8 cups per day.
Mhm.
But it sounds like I know on other episodes of our podcast here, we've talked about nutrition needs and how they vary and they're individualized. So it sounds like fluid is aligns with that.
Yes.
You already mentioned a few things like our location, the weather, are there other factors or conditions that impact our fluid needs that we should consider?
Yes, absolutely. So we have to look at our exercise. If we're exercising strenuously, especially if we're exercising outside, or even if we're working outside in this heat and humidity. If we tend to sweat a lot, some people sweat more than others. Um, Also, too, if you, unfortunately, we've all had those pesky GI bugs where, unfortunately, lots of vomiting, diarrhea. Those are unfortunately ways that our body loses a lot of fluids, or if we're running a fever. So those can all be instances that can affect our fluid needs and increase our fluid needs as well.
So I think we've all learned today that, it's not as straightforward as 8 cups per day. There's other factors, there's other numbers to consider. I know you mentioned, looking at the color of our urine as a way to tell if we're getting enough fluid. Are there anything else that we should be looking out for to ensure that we are properly hydrated?
So the urine color is again usually the first thing we need to look at, and that's usually the best indicator. Thing to keep in mind is the first urine of the day, the first time we pee. That's probably going to be our darkest urine of the day. Hopefully, as we're getting more hydrated during the day, we should see our urine becoming more clear. But listen, look at your thirst. If you notice if you're becoming more thirsty, paying attention to that is important as well. If you notice you're sweating more, if you're outside more, if it's hot and humid, those can also be instances, again, where it's just our body's way of telling us, hey, I need to drink more fluids.
Yeah, that makes sense. Really, staying in tune to your body, like the symptoms you mentioned before of headaches, especially during this heat this week. Um,
Yes.
I've often heard that it's important to drink even when you aren't necessarily feeling, thirsty, so you stay on top of your hydration. Um, So having these checks, these other checks that you mentioned, it would be good to help remind us all of our hydration status. I actually think my next question aligns with the question we just got in the Q&A, so this is great. As we start to think about applying these fluid recommendations to our everyday life, I was thinking, you already mentioned water is not the only source of hydration, but what are some of these other sources that we should, count or consider incorporating?
Sure, yes. So, any type of liquid. So, if we're drinking milk or any plant based milks, herbal teas, soups, broths, things that can become a liquid at room temperature. So, even adding extra ice to our drinks or ice cream, popsicles, Jello, even. Jello becomes a liquid at room temperature. You can certainly do like the electrolyte drinks, the Propels, soda. But also don't forget about fruits and vegetables. Surprisingly, fruits and vegetables have a high water content. That's really what makes them so low in calories, is because they have a lot of fluid in them. These water-rich foods actually often account for at least 20% of our total fluid intake for the day. For example, one of my favorites, watermelon. So just like the name sounds, watermelon actually has a very high water content. Most melons, though, as well. Also citrus fruits, oranges, grapefruits, a lot of your fruits and vegetables, particularly all of your lettuce, your salad greens, tomatoes, peppers, cucumbers, celery. So those are all foods that surprisingly do have a lot of fluid in them. So that also can account and help us get those fluids in that we need.
Great. So yes, while we all think drinks are the only source, they might be the primary source, but there are other ways, those foods you just mentioned to consider. I liked that tip of adding ice, even though I don't like to add ice, but maybe during this heat I should. So since drinks are likely our main source of hydration, I wanted us to talk a little bit about the different drink choices. There are so many to choose from. Water. Now there's, seltzer water, there's soda, of course, juice, coffee, energy drinks, so many more. Those are just a few. But when it comes to hydration or health, are there certain drink choices that are better than others? What should we be considering?
So we always say water is always our beverage of choice. So we're always encouraging patients, really, yes, to try to drink more water. But the one thing we do want to be careful with, especially in the summer, because yes, we are telling everybody, okay, we need to stay hydrated. But a lot of these other beverages can often contain a lot of sugar. For example, sodas, sodas, regular Gatorade, things like that. So we don't want to get a lot of sugar in our beverages, even though we're trying to stay hydrated. Here's an example. A 20-ounce bottle of regular soda actually has 16 teaspoons of sugar in it. That's a lot. So yes, we need to stay hydrated, but we certainly don't need all of that sugar in our diet. Our general rule of thumb, we often tell patients, is your beverage should have less than 10 calories a serving. Zero is always a good number. So those zero flavor or those 0-calorie beverages, Gatorade zero, Powerade zero, zero sodas. But we're also okay with those little sugar-free flavor packets. They're nice. We understand that sometimes it is nice to have flavored waters, even the sparkling flavored waters. We also want to throw out a caution flag. Again, a lot of folks, yes, we like those iced coffee drinks and the fruity drinks and the frozen hot chocolates. Yes, they are yummy. But again, just to throw it out there, I did some research. A large frozen hot chocolate, surprisingly, like 700 to 800 calories. That I was just astonished when I was doing this research. Again, also be careful of the energy drinks, because it's been in recent research. I mean, some of those really have a significant amount of caffeine as well, in addition to sugar. But we definitely want to make sure that we're not taking in a lot of sugar.
Yeah. Wow, those numbers. I mean, can you imagine sitting here watching me eat 16 teaspoons of sugar? But that's what you're drinking. So wow. I just want to ask this. When question came in, can we count caffeinated drinks towards our, daily fluid? Would that count?
That is a good question. So actually in my research, because we've always been told, okay, yes, caffeine can be dehydrating. It can. But what I was coming up with research is, yes, caffeine is dehydrating, but they actually do count caffeine in as liquid these days. But again, from nutrition, we kind of throw up the caution flag that because caffeine has some other side effects as well. It can increase your heart rate and your blood pressure and so on. So, but the recent research indicates that yes, caffeine, they do count it as fluid.
Question, is there sugar in green smoothies?
It's
Green, in quotes.
Yeah. It depends on the ingredients. One, are they adding it to the drink? So sometimes with smoothies, we have to be cautious as well, just because. So fruits, dietitians, we often prefer patients to eat their fruits rather than drinking it. You can inadvertently, if you're adding a lot of ingredients to these smoothies, a lot of fruits, things like that, again, you can end up with a couple 100-calorie smoothie as well. So I guess I'd have to actually look at the ingredients and the nutrition label to really determine it. But if they're adding a lot of fruit to it, yes. So fruit has natural sugar in it. If they're adding sugar to it, it certainly can play a role.
Okay. So kind of to go back to what we were talking about, sounds like no surprise, water remains the best choice. And as silly as it sounds, I've heard some people say that they don't like water or they struggle to drink it. What advice would you have for someone in this situation? Is it okay to drink other things, add, those packets like you mentioned, as long as you're still staying hydrated?
Yeah, so we are okay with the sugar-free packets. We often also encourage our patients to, maybe you can try flavoring water more naturally. Like, for example, you can certainly, a lot of our patients will add lemon juice to their water, or slices of lemon or lime or oranges. You can throw some berries in your water. You could muddle them a little bit, throw them in. I've heard some patients will tell me they add mint and cucumber. That sounds like a nice combination. Some folks even add herbs to their water, like rosemary. Again, it kind of gives a little hint of a water as well. Um, but again, we're okay with the sugar-free packets. There's also a product called Mio. It's almost like liquid crystal light. Um, if you're drinking the juices and the sodas, but again, the only thing, just to read the label and see, okay, how many are there added sugars in them? Are there hidden sugars in them? That would just be the only thing, just to be cautious about.
Yeah, I think you've given us some great insight to reminds us, like, obviously, yes, hydration, especially in this heat, is important, but there's other things to consider, like you said, the 10 calories per serving, the sugar content, to keep in mind when we're selecting our beverages, because those have a bigger impact on our overall diet. So if someone is, on today's call and says their goal is to improve their hydration, what would your top three tips be for them?
So one of the first things we often recommend is carry your water bottle with you everywhere. Okay. Um, we usually have ours on our desk here at work. We tell patients, take it wherever you go, just because if you're racing out of the house and you don't have your water with you and you're gone for a couple of hours, well, now you're already behind the 8 ball. So have it right there, front and center, because that's going to be that visual reminder, like, oh yes, I need to drink something. Another thing is just set yourself reminders. It sounds kind of funny, but hey, we all need reminders in life. You can, set your phone to go off at certain times, or your watch. There's actually nice apps these days that will remind you or help you track it. There's water bottles that will tell you, hey, I need to drink so much by this time of the day. Those work as well. So that would be the second reminder. And also the last one, this is more for folks who are trying to maybe come off of drinking so many sugary beverages. Yes, it's great if we can say, like, no sugar, just stop drinking it all. But again, we have to be kind of realistic. So what we often will tell our patients is, okay, for every bottle of juice or soda you drink, then you have to drink a bottle of water, because at least that will hopefully cut your soda juice intake in half, but also increase your water intake in half as well. And that's off to a good start.
Wow, those are some great tips. I know hydration is something I personally struggle with, so I'm gonna give some of those a try. I do have my water bottle here, so off to at least a good start there.
Yeah,
Um,
good.
so I know we've talked a lot about, hydration importance, dangers of dehydration, but what about overhydration? Is that possible to overhydrate and drink more than what your body needs?
Yes, actually, it is possible. It's possible to drink too much fluid. There's something that's called hyponatremia, which is a condition of low serum sodium in your bloodstream. That's also not a good thing, too. So, yes, we need to stay hydrated. There's like that fine line. So, we often say, like we said earlier, yes, your urine's your best color, light to sunny yellow. However, peeing, if your pee looks like water, if it looks clear, that's a pretty good sign that maybe you're drinking a little bit too much water. Or if you have too many trips to the bathroom. With my research and with preparing for this, it came up that if you're going to the bathroom more than 10 times a day, that could mean, again, that could be a sign that maybe you're drinking too much water. Hyponatremia can also cause some symptoms like nausea, vomiting, diarrhea, headaches, confusion. So again, it's something we do want to prevent. Our body is meant to be in sync. So all of our electrolytes want to be normal, and the body tries to normalize that. So yes, we need hydration, but yes, we can definitely drink too much water.
Very insightful. Um, so when I prepared for this, I said with the hot summer approaching, but I think it's here.
Yes.
Um, kids in sports, or maybe even if you're a runner on today's call, I know the topic of sports drinks is often debated. Is water enough when exercising, or when are these electrolyte sports drinks indicated?
So the electrolyte sports drinks, yes, actually they do have a role. So we often say, so if you're exercising intense exercise, example, more than 45 minutes a day, or you're really sweating profusely when you're exercising, or again, if you're outside in this heat and humidity and you're sweating a lot, you're working out in extreme heat, which usually isn't recommended, to be honest. Um, so yes, those are definitely instances that yes, an electrolyte drink, again, maybe look for the zero varieties, but they certainly are helpful. Again, going back to, unfortunately, we've all had those nasty GI bugs, nausea, vomiting, diarrhea, fevers, all increase our fluid intake. But if you're putting out a lot of fluids, like with vomiting, diarrhea, you certainly need to replace those electrolytes as well. So they do have a role. Now, for me, if I'm taking a quick 10-minute walk at lunch, no, I probably don't need to drink Gatorade when I come back to the office. Probably not. But those could be some instances where they would be indicated.
Um, along those lines, consumers are confused these days. So many products out there. Not only are there the wide variety of sports drinks, my nephew is into Prime drinks, but there are also these hydration boosters, hydration multipliers. So, what are your thoughts on these products? Should we be considering them? Are they a scheme? What are your thoughts?
That's a good question. So they actually do have a role as well. We do find actually some of our patients are using them, like the liquid IVs, for example. Hydration boosters or hydration multipliers, what's interesting about them is not only do they contain electrolytes, but they also contain usually some vitamins as well, particularly B vitamins. Um, Oftentimes, these hydration boosters, they actually can help us rehydrate faster than water alone. So these extra ingredients in them actually kind of help get those nutrients into your cells a little bit faster. What's also nice is, again, oftentimes they're convenient. They come in those little single packages, so you can just slip them in your pocket instead of carrying that big jug of Gatorade around with you, as well. So they're convenient. But again, we want to look for the low sugar varieties because these products also do contain sugar. So yes, if we need the extra electrolytes, but we don't need all that extra sugar as well. The same rules would apply kind of like with the electrolyte drinks. Again, if you're exercising intensely, you're sweating profusely, or you're typically do just sweat a lot in general. You're working outside and with the heat and humidity, or with illnesses. Those also could be indicators for using these products. Kids nowadays, typically they're probably, if they're not already in football practice, exercising a couple hours a day out in the heat. or any type of sport in general. So yes, they certainly do have a role.
Great. Yeah. No, I personally, was surprised. I saw Liquid IV out there, and then when I saw that there was all this sugar, it caught me off guard. So that's a good reminder to, check that too.
Yes.
So that was my last planned question. I'm going to check the Q&A here, and anybody who's on the call, please feel free to add in more questions. I think we hit on this, but any last examples of alternative drinks that can qualify as water? What are the best choices?
So, forgive me if I've already mentioned some of them. So water, so certainly water, the sugar-free packets, the zero, like zero Gatorades, the electrolyte drinks, Propel. Milk can also be counted, or your plant-based milks, almond milk, soy milk, soups, broth, herbal teas. That's sometimes nice in the summertime. You can actually, instead of drinking the sugar sweetened teas, you can just make your own herbal tea, do it unsweetened as well. Things that can become liquid, adding that extra ice to things, to your beverages as well. So those can be some ideas too, hopefully.
Yeah. I think we talked a little bit, but what do you think about adding electrolyte tablets to water, for example, NUUN tablets?
So again, probably the same ideas for, again, if you're somebody that, I guess kind of the same rules for the electrolyte drinks or the electrolyte enhancers is strenuous exercise. If you're exercising strenuously, sweating a lot, working outside. Yes, I actually, when I was preparing for this, I was kind of running it by my physician assistants in our office, and our one PA does hot yoga. So she said, yeah, she said, and so she said it's hot. It's at least an hour long. She's sweating a lot, so she does try to supplement with either an electrolyte drink or a liquid IV. So I guess I think the same rules would kind of apply too. For the normal person, if you're really don't sweat too much, you don't sweat much, you're not much of an exerciser, probably not needed. But if you are, that can certainly be built into that as well, into your repertoire.
For the question on additional webisodes, we host a webisode every third Wednesday of the month. Next month is on injury prevention, management, and recovery. So be sure to register. I think then August is on sleep health. So yes, we do have additional ones. Question on what a hydration booster is. Do you have any sample names?
So hydration boosters are, like, for example, liquid IV. Hydration booster, they contain electrolytes, but they also contain typically like B vitamins. Sometimes they have vitamin C in them. So they do provide some of those nutrients as well. They basically come in single serve packets. So it's almost like, for example, it's almost like the Gatorades or Powerades. They typically do have more electrolytes in them, but they also contain these extra B vitamins, vitamin C, and it's enhanced as well.
Yeah, I would say liquid IV is probably a really common one. I know I've seen like LMNT or something, just different brand names out there.
Yes.
And then thoughts on aloe drinks.
So I guess, again, if you're looking at the nutrition label, the best thing to do is, dietitians are always going to say, read your label. What you want to do is look to see, okay, does it have any added sugars? If it has calories in it, you have to look at, well, where are those calories coming from? Typically in drinks, it's most likely might be sugar. And that's the rule of thumb is, you just don't want to have a lot of hidden sugars in your drinks. So if it has calories, like again, 0 is a good number, less than 10 calories. But if your aloe juice is like 200 calories, it's probably coming from somewhere. So that would be my concern, like where are those calories coming from? So you can either look at the actual label, look to see, well, how many grams of sugar is in the label itself, or you can look at the ingredients. We often say the first 3 ingredients is usually is where the ingredients are mostly coming from. So if the first ingredient's water, that's the main ingredient. If the second ingredient is sugar, that's the second one. So that would be the 2 places to look for.
Great questions, everyone. I want to be mindful of the time here. I want to thank you, Rose, for sharing your experience, your tips with us today. Thank you to everyone who tuned in and joined us for this conversation. We hope you found it useful and relatable. If you have any additional questions, you can email them to me at wellness@geisinger.edu. I'll get them to Rose. We'll get you a response. But like I mentioned, be sure to join us for our next month, where we're going to talk about injury prevention, management, and recovery related to exercise. So thank you all. Stay cool and have a great rest of your week. Bye now.
Thank you. Bye-bye.